96.5 KLH. I'm Dave, along with Doreen and Gino. This is the Miracle Marathon benefiting Children's Wisconsin, one of the finest children's hospitals in the world. And how lucky are we to have it right here in the state of Wisconsin? Right now, we're going to introduce you to a very special young lady. Her name is Makayla Seisel. Makayla, how old are you? 10 years old.
Wow.
And I assume that's your mom, Jessica, there. Hi, Jessica. How are you?
Good. How are you?
I'm fine. This is a very complicated journey that we're about to weave for those who are listening and or watching this, of course, online. Complicated and also unbelievably unique on so many levels. Jessica, let's start with the beautiful little girl next to you and when this all started and what you and Makayla have been experiencing and going through over the past 10 years.
Yeah, so when Makayla was born, she was just a fussy little baby. And everybody just kind of said, oh, she wants her mommy all the time. But you know, that mother's gut knows that there is something more to it.
Yeah.
And it wasn't until she was about 3 years old that we really started to see any signs that things weren't progressing the way that they should. Makayla started losing like about a third of her body weight. She was 27 pounds at 3 years old. And at that point, she was diagnosed through our pediatrician with celiac disease. And we live in Illinois. So we started with some of the Illinois hospitals. We started in Chicago. And she kept losing weight and they kept telling me, oh, she's not feeding her a gluten-free diet. But we had redone our entire house. There was no gluten in it. We got a second opinion. So we ended up now at our second hospital where she was diagnosed with a fructose malabsorption and lactose intolerance. And at that point, she gained 15 pounds and grew 2 inches in 6 months, which was amazing.
Right.
But there were things in that time that were like just still not right. She had a lot of chest pain and they kept treating her for acid reflux. Fast forward a year or two, we found out that it was pain in her lungs. So over the course of a couple of years there, we were in probably 4 or 5 Chicagoland hospitals with a pulmonologist at one and a GI doctor at another. And she also started to have chronic sinus infections. Her sinuses were 100% compacted. And nobody was giving us any answers. Nobody was communicating with us. They wanted to do a sinus surgery. She already had one sinus surgery done. They wanted to do another one where they'd remove egg-like structure of her skull. And we kind of said, well, this is our baby girl. She's in first grade at this point. She's little, like to start removing even those little egg-like structures seems to be kind of a major thing. Is it going to impact her for the rest of her life? So we went to the Mayo Clinic for the first time, spent a week up there. And that was actually kindergarten. I'm sorry. Fast forward the next year, first grade, we went back to the Mayo Clinic. We had the surgery done. They sent us to Children's in Milwaukee. They said, everybody thinks that, you know, go closest to home, but sometimes it's about going. Sorry, I get choked up. It's about going where they see your child for who they are. And when we switched to Children's of Wisconsin, all of a sudden, all of the specialists started communicating together. Our pulmonologist and our ENT worked together in such a close team that I can only send one of them an email and both of them are filled in. And so the quality of care at that point changed for us. We were also able to, with the doctors working together, take her off of some of the medications she had been put on over the years. At that point, we took her off of a medication she was on for chronic migraines. And when she was on it, we weren't sure, was there a learning disability? Was it the medication? Turns out she does have dyslexia, which Children's helped us to get a handle on as well. But when we took her off that medication, she started having vomiting fits. And later she was diagnosed with abdominal migraines, which triggers cyclic vomiting syndrome. And so she'll vomit every 20 minutes for 12 to 14 hours.
Oh my God.
And it's normally not stopped until we end up getting either admitted or into the ER for fluids.
Just a few months ago, I had one, but it was worse than normal, but it was actually only 2 hours. But I was vomiting almost every 5 minutes, and I couldn't even move without vomiting. And I even ripped my esophagus. Yeah, but now if I feel like I'm gonna vomit, I just take a pill that I take for 3 days, and it stops me from vomiting.
So, and we actually at Children's, there is one of the, I would say, the world's best cyclic vomiting specialist, and she has, she's changed Makayla's life. So, for those of you who are watching online, she wears a neurostimulator on her ear, and it was invented at Children's of Wisconsin by Dr. Kovacic. And so it has 4 electrodes that plug into her ear, and it essentially rewires her brain. So the nerve signals are sent to her stomach in a different way. And she was having daily stomach pains for her entire life. And it was almost at the point where she was complaining of them so often. My husband and I would look at each other and we're like, is it anxiety? Is it true pain? What is really going on? And within 2 weeks of having the first neurostimulator put on, the stomach pains disappeared. And the vomiting attacks are at a minimal. So we go up for 4 to 6 weeks every Monday. They put it on. We take it off on Saturday mornings and go back up the following Monday. And so
now this is I have to tell everybody, Jessica, that this is so innovative and so unique that it was written up. Parents Magazine listed it, Children's Wisconsin included in the list of top 15 children's hospitals in innovation and technology for research around this particular device that you're talking about. So this is not just innovative for here in Wisconsin. I'm talking worldwide innovation. And you've experienced that. You've had that unique perspective. The Mayo Clinic, the Chicago Children's Hospitals, places that have stellar reputations and do a great job, yet they still can't live up to the level that Children's Wisconsin has. The bar that they've set is so high when it comes to coordinating care, caring and genuinely and sincerely caring for their patients and looking at them as an individual and seeing them for who they are, as you put it.
Absolutely. There's something very unique about Children's.
When you talk about what it means to assemble this team, because the communication that you talked about, after being frustrated by going to hospital, talk about what it meant when you got this team together.
It meant that we could move forward, right? So we were having one doctor give this medication, one doctor give this medication, and now we have the 2 doctors talk, and she's on one medication that can treat both things. Or the other thing is in our family, we feel like medication is appropriate sometimes, but there's sometimes we need to look at things from a holistic approach. And by being able to have this team, so when she's seen in the pain and headache specialist, she sees a psychologist who does biofeedback with her, and she also sees a medical doctor who gives her the medication. And then they communicate really well with, Dr. K and GI, and it's kind of changed her from being a patient to a person.
Well, and by being able to move forward, then you have hope, right? Which then leads me to Makayla, drawing. Tell us about your artwork.
I don't know. It's just something, I don't know. I just did that one.
Really good.
It's beautiful. It's the tech note thing, and it's got hope on it, right? And
it's the thing that we're giving out as an incentive item, and you are the fine artist to provide that beautiful drawing. Makayla, when you think about going to Children's, what do you think about? What's the experience like for you?
I think it's easier than going to the other hospitals that I went to because the other ones were more chaotic and I had to go to all of the different ones. And even the Mayo Clinic was chaotic because I have to have appointments after appointments. And this one even is kind of fun because, like, between appointments, I get to like send my dad like airplanes that say like, "Are you having like a good day?"
Yeah, so by the new Child Life Center, there's, I don't know if you guys are familiar with it, but there is a digital screen where you can send a paper airplane off. So it's always kind of like a little tradition of ours that we always go and send an airplane to somebody. And I think Child Life has helped make it more friendly for Makayla as well there.
And Makayla also has got a deathly fear of needles, which I think anybody would
Yeah.
have a fear of needles, and they help with that as well.
Yeah, so that is actually our same therapist that does the biofeedback in the Pain and Headache Center. We have had 5 or 6 people holding her down in the past that she was covered in bruises, and not because anybody was doing anything wrong, but because we just needed to get the needle in, and we were in an inpatient stay, and somebody called the transport team, and the transport team was the first people to treat her with
like I had feelings and like they weren't just like saying like we need to get this in like right now. And it took almost actually like 2 hours to get the needle in because I was so scared. I tried it 3 times and only the 3rd time worked because my vein kept just collapsing. And I was so scared. But finally on the 3rd time it worked and I was just scared, but finally the 3rd time worked.
But that night changed everything for us. That night helped us to get the help for the needle phobia therapy. We didn't even know that was an option beforehand. And by them validating her feelings, it almost gave me as a mom permission to kind of stand up for my daughter in a different way and to say, hey, listen, we're not going to rush this. We're not going to push her. You know, sorry, she's making fun of me because I'm choking up. But it really, like, that night changed everything for us. It changed the way that I parent her. And that what happened in that room was so special.
Well, and it changes your family as well. Your entire family.
And you said they didn't find a cure for her, but they did change her heart, right? And yours too.
Everything was changed for us that night. They saw her as a little person. And at the end of getting the needle in, one of the transport team kissed her on the top of her head. And she looked at me and she apologized. And she said, I don't know why I did that. I'm so sorry. I think I crossed a boundary. And I said, you have no idea what you have done for us. Just somebody who could connect with my daughter when she needed it most. And it was in the middle of COVID when my husband and her father couldn't be there. And we hadn't seen my son in a week. And we really we needed their love and support at that time. And they showed up for us big time.
The next time I was in the hospital after that, it was like a month later. I had to get a new IV and we asked for them, and it was 2 people. One of the people was different, but one of them was same from last time, and they were on their phone, and we were like, why don't they recognize us from last time? And then we realized after my IV was in that they were texting one person from last time, and she brought me a cup that had my name on it because she was saving it for me. And she was looking for my name since I left.
You see, that's the kind. Okay, I know I've said this probably too many times, but that's the reason why. You guys are from Illinois. You've been to the Mayo Clinic a couple of times, all the Chicagoland hospitals, yet you drive to Children's Wisconsin because of the level of care and the concern, the love, the emotion, the genuine care that is given to Makayla, not just from the perspective of the medical community, but also the emotional support and the support needed for the whole family, which you just can't, you cannot train people to do something like it. It has to come from the heart, and it's there, it's sincere, and that's what Children's is all about here in Wisconsin. Thank you so much for your time, Makayla. It was really awesome to meet you. You as well, Jessica, and we really appreciate you, Jessica, getting emotional, because that actually helped. Makayla, your mom helped us a lot by being emotional. It helped us raise money for
and thank
children.
you for your artwork, Makayla, because now we're all going to have a little piece of you with us too.
That's right. We'll have your artwork with us all the time. Thank you so much. We really appreciate it.
Thank you.
Bye. Thank you.
You guys
Bye, guys.
were great. Makayla and Jessica Seisel. You're listening to the Miracle Marathon on KLH.